Hi, I'm Lou Alaruzo.
And I'm Thomas Hoad. We are biotech entrepreneurs and founders of ICanWin. As biotech entrepreneurs, we receive calls nearly every week.
The calls are often the same. I hear a desperate voice on the other end. The patient says, I have stage 4 cancer. My doctor has told me I have failed all other options. And I have to tell this person, I'm sorry, there is nothing I can do for you. At ICanWin, we believe, as long as the proper regulatory requirements are fulfilled, that any physician should be able to offer cutting-edge treatments to their patients who have exhausted all other options.
5 years ago, Idilia was diagnosed with stage 4 metastatic breast cancer. She had failed conventional treatments and was given about 6 months to live. Now, Idilia was lucky. She had a doctor who made sure she had access to experimental or investigational therapies that could possibly improve her life.
Yo llegué al hospital Revaliati y me habían dicho que el cáncer estaba avanzado y no me podían operar. Me hicieron 4 tratamientos y a Dios gracias esto no llevaba a otras consecuencias.
The therapy described by this individual is still in the early stages of the rigorous development and approval process and was only administered internationally in a compassionate care setting under appropriate regulatory guidelines. Neither the therapy nor the compassionate care program described in this video is available in the United States.
Delia wasn't the only one who benefited from compassionate use programs. Her whole community benefited from her teaching ability. Unfortunately, many communities aren't so lucky. According to the World Health Organization, every year nearly 30 million people die worldwide under palliative care. Many of these people might have been helped by compassionate use programs. At ICanWin, we want everyone to have access to experimental or investigational treatments once they have exhausted all other options.
Medical professionals use the term compassionate use to refer to the treatment of a seriously ill patient using a drug in the early stages of the regulatory process when no other treatments are available. We believe the biggest barrier to expanding compassionate use programs are operational. Doctors in the field are passionate about helping the patient. Regulators have developed specific laws for compassionate use programs, and biotech companies want to help too. The problem is that there's no easy path to match experimental or investigational therapies with physicians to administer compassionate use therapies. ICanWin fills this gap while observing local regulatory and legal requirements. We match developing treatments with doctors in the field. As entrepreneurs, our experience with foreign clinical trials makes us uniquely qualified to establish this nonprofit organization. We've already partnered with clinical sites in Europe, South America, China, and the Caribbean to provide access for local patients in need.
To provide access to patients running out of treatment options, we need your help. We need $200,000 to launch the ICanWin platform. The money will be used to build a database, hire staff, and provide patient care. Additional funds will allow us to treat even more patients.
With your help, we can build a network to offer potentially life-altering therapies to people like Idilia. Donate today, and together we will work to make a difference in the lives of those who need it the most.